30 days before a stroke. Your body gives you warning signs. Here are 8 of them. A stroke happens when there is a disruption in blood flow to any part of the brain. When this happens, brain cells begin to die within minutes. However, many people don't realize that the body gives warning signs 30 days before a stroke occurs. If you are able to recognize these early signs, then you can seek medical help before the stroke happens. And if it does happen, you may be able to reduce the severity of your symptoms by acting fast. That is why in today's video, we are going to tell you about 8 warning signs your body gives you 30 days before a stroke. Be sure to watch until the end because the last one may surprise you. Before we get started, be sure to click the like button for more health-related videos. Also, be sure to subscribe and click the notification bell for more health-related videos. 1. Trouble sleeping. Insomnia is a common problem that affects millions of people around the world. It can be difficult to fall asleep, stay asleep, or both. Many people try to self-diagnose their insomnia, but it is important to see a doctor for an accurate diagnosis. There are many things that can cause insomnia, including stress and anxiety. But did you know that it can also be a sign of something more serious like a stroke? A study published in the journal Stroke found that people who had experienced a stroke were more likely to have had insomnia in the year before the stroke than those who did not have a stroke. The study suggests that insomnia may be a risk factor for stroke. Another study found that the risk of having a stroke was 2.5 times higher in people who had insomnia compared to those without it. So, if you have been having trouble sleeping lately, it is important to see a doctor, especially if you have other risk factors for stroke, such as high blood pressure or diabetes. 2. Dizziness. Dizziness is a common symptom that can be caused by many different things. In some cases, dizziness can be a sign of something more serious, such as a stroke. There are many different types of dizziness, so it is important to pay attention to the type of dizziness you are experiencing. If you experience sudden onset of severe dizziness, especially if it is accompanied by other symptoms such as difficulty speaking or weakness, then it is important to seek medical help immediately, as this could be a sign of a stroke. However, if you experience chronic or long-term dizziness, it is still important to see a doctor to rule out any underlying causes. 3. Vision problems. Vision problems are a common complaint, especially among older adults. While most vision problems are not serious, they can be an indication of a more serious underlying condition. For example, vision problems can be a sign of diabetes, high blood pressure, or a stroke. Studies have shown that people who experience vision problems are at increased risk for stroke. One study found that people who had experienced a stroke were more likely to have had vision problems in the year before the stroke than those who did not have a stroke. The study suggests that vision problems may be a warning sign for an impending stroke. 4. Loss of balance. When you start to lose your balance, it can be frustrating and even embarrassing, but it's important to take it seriously. That's because loss of balance can be a sign of something more serious, like a stroke. A stroke can cause a loss of balance because it affects the part of the brain that controls coordination and balance. This can happen suddenly and without warning. It can be hard to tell if you losing your balance because of something simple like being dizzy or if it is something more serious like a stroke. That's why it's important to pay attention to your body and seek medical help if you experience any sudden changes. If you experience a sudden loss of balance, especially if it is accompanied by other symptoms such as dizziness or blurred vision, it is important to seek medical help immediately. Early treatment can help to improve your recovery and reduce the risk of further complications. 5. Foot or leg swelling. Swelling in the feet and legs can be caused by a number of different things, but it's important to pay attention to it. That's because swelling in the feet and legs can be a sign of something more serious, like heart failure or a stroke. When the heart is not pumping properly, blood can back up in the legs and feet, causing them to swell. Similarly, a stroke can also cause swelling in the feet and legs. This is because a stroke can damage the part of the brain that controls movement and coordination. As a result, you may have trouble moving your legs and feet, which can lead to swelling. If you notice that your feet and legs are swollen, it's important to see a doctor right away, especially if it's accompanied by other symptoms like shortness of breath or weakness. No. 6. Tingling in hands or feet. Tingling in the hands or feet can be a sign of many things. In some cases, it can be a sign of something more serious like a stroke. A stroke occurs when there is an interruption of blood flow to the brain. This can cause brain cells to die, and it can also cause the person to experience symptoms like weakness, numbness, or tingling in the hands or feet. If you experience tingling in your hands or feet, it is important to see a doctor to rule out any potential causes. It is also important to pay attention to other symptoms that may be present, as they may provide clues as to the underlying cause of the tingling. 7. Fatigue. Fatigue is a common symptom that can be caused by a number of different factors. It can be the result of physical exertion, mental stress, or lack of sleep. However, fatigue can also be a sign of something more serious, such as a stroke. A stroke occurs when there is an interruption of blood flow to the brain. This can cause brain cells to die, and it can also cause the person to experience symptoms like fatigue. If you experience persistent fatigue, especially if it is accompanied by other symptoms, such as dizziness or weakness, it is important to see a doctor to rule out any potential causes. No. 8. Changes in bowel movements. Our bowel movements can tell us a lot about our health. When we experience changes in our bowel movements, it's important to pay attention, as they could be a sign of something more serious. For example, changes in bowel movements can indicate a change in diet, stress levels, or hydration. However, they can also be a sign of a stroke. A stroke can cause changes in bowel movements due to the disruption of blood flow to the brain. This can cause the muscles that control bowel movements to become weak or paralyzed. If you experience sudden changes in your bowel movements, especially if they are accompanied by other symptoms such as dizziness or confusion, it is important to seek medical help immediately. Conclusion: it is important to be aware of the warning signs of a stroke so that you can seek medical attention promptly if needed. The warning signs of a stroke can include trouble sleeping, dizziness, vision problems, loss of balance, swelling in the feet or legs, tingling in the hands or feet, fatigue, and changes in bowel movements. If you or someone you know experiences any of these warning signs, it is important to seek medical attention right away. Early detection and treatment of a stroke can make all the difference in preventing further complications and improving outcomes. Do you find this video helpful? Let us know in the comments section below. Make sure to subscribe so you don't miss out on future videos. Don't forget to like and share. Stay healthy.